January is Cervical Cancer Awareness Month. Nearly 13,000 women in the United States are diagnosed with cervical cancer each year, but the disease is virtually always preventable with vaccination and appropriate screening. Dr. Anna Beavis is a gynecology and obstetrics expert with Johns Hopkins School of Medicine, and she is joining us this morning. Good morning. Thank you for coming in.
Thank you.
So as we talk about Awareness Month, what do we want people to be aware of when it comes to cervical cancer?
Well, as you mentioned, I think the most important thing to know about cervical cancer is that it is preventable, but it's only preventable if you can access care. So there's two ways to prevent it. One is to get your pap smear on time and regularly, and the other is to get vaccinated. And vaccines work best if you give them before you're exposed. And we know that nearly 99% of cervical cancers are caused by HPV. And so if you get vaccinated before you're exposed to HPV, which is typically through sexual transmission, then you have the highest chance of preventing your son or daughter from getting cervical cancer.
So when should you start getting that HPV vaccine?
So the vaccine is given, there's two ways to give it, either 3 doses or 2 doses, depending on the age, but it should be given between the ages of 11 and 12 in order to be well before, exposure to HPV. And if you give it before the age of 15, it's only 2 doses, which is a plus.
When this all came out, a lot of parents had a concern about, well, why would I give my kids a vaccination against an STD? Isn't that, I'm probably opening a can of worms there, but you would say what to that?
So it's actually something at Johns Hopkins Medicine that we've explored, and there's a lot less concern about that now, I think, because of the increased education. So anyone who's sexually active in any way at any point in their life will be exposed to HPV. It is basically, everyone's been exposed. And just a small percentage of those people will get an infection that will last long enough to cause a cancer. And so I think that most people are recognizing that while this is transmitted sexually, it's also something that nearly everyone has at least been exposed to in their life.
So what are the symptoms? What do you look out for?
So most women will not have symptoms if it's early stage. So those are the women getting pap smears, and the pap smear is designed to pick up the pre-cancer, so hopefully it doesn't develop to cancer, or to pick up early stage cancer. Now in women who haven't sought care, it's been several years since they've seen a gynecologist, they may have bleeding after sex, they may have bleeding between periods or heavy periods, or bleeding after menopause, as well as pelvic pain and pressure.
Okay. All right, so best thing just to be vaccinated, get the appropriate screenings. You talk about the pap smear. Is that for every woman every year?
The guidelines have changed. Depends on the age, and every woman should discuss with their gynecologist the most appropriate. Somewhere between every 3 to 5 years. It's actually a little bit less often than it used to be.
Okay.
And then if a woman is diagnosed with cervical cancer, it's really important to seek out a specialist, so a gynecologic oncologist like myself, and it's really important to see that specialist to improve survival from this disease.
All right, all good to know. Thank you so much for coming in.
Thank you.